Have you ever been on an ultrasound scan bed and you are wondering, why is this scan taking so long? Is this sonographer saying something bad? Let me explain what is actually happening. Hello, my name is Chinaza. I am a medical sonographer, and on this channel it is everything ultrasound. Today I am going to be answering one of the questions you patients have in mind, and for today the question is, what is the duration of an ultrasound scan, or how long does an ultrasound scan take? Let me start by saying there is no fixed duration for an ultrasound scan. Some patients like to box their sonographer in by asking questions like, please, how long does this scan take? Or how long will the scan take? Or please, I am in a hurry. Can you give me an exact minute of the scan? What I do personally, I tell them there is no specific timing for this scan, but it will not take so long. Now you are wondering why. Unlike some other radiological procedures, ultrasound is a real-time imaging procedure. When I say real-time, what I simply mean is we are looking at videos in real time. Think of it this way. When you are taking a picture or looking at a picture, you only need one click or one swipe and you are done. But when you are watching a video, you could take 2 minutes, 3 minutes, 5 minutes, 10 minutes, depending on how long the video is or what exactly you are looking out for. And that is exactly what ultrasound does. We are looking at your internal structures as a video in real time, what is happening inside your body. So how long it takes depends on some factors. I am going to be listing those factors and I am going to be explaining them. Now, one of such factors is the type of scan. There are various types of scan. We have the breast scan, pelvic scan, thyroid scan, obstetric scan, which is popularly known as pregnancy scan. A person who is doing a thyroid scan will live faster than a person who is doing an abdominal and pelvic scan. Why? In a thyroid scan, we're only looking at the thyroid gland. The organ we are looking out for is just one. It's not big. The scanning area is not large. So the measurements are not much. So you will definitely live faster than a person doing an abdominal and pelvic scan. In abdominal and pelvic scan, the scanning area is large. The organs you are looking out for are multiple. The measurements are more. So you will definitely spend longer time than a person who is doing a thyroid scan. A person who is doing a first trimester pregnancy scan will definitely live faster than a person who is doing a third trimester pregnancy scan. I'm sure you are getting the picture now. Why? In a first trimester pregnancy scan, what we are looking out for, the things are very few. The scanning area is smaller because by then the uterus is not so enlarged, the baby is not so big, our measurements are limited. But in a third trimester scan, what we are looking out for is actually very much. The measurements are more, the scanning area is larger, the scanning techniques requires plenty maneuver, and it will definitely take longer than a first trimester scan. Another factor that plays a role in the duration of your scan is the size of the patient. You already had me talking about the scanning area. When you are scanning a slimmer or a smaller patient, it is actually easier and faster when you are scanning a patient who is on the large size or who is on the bigger side. Why? Like I said, ultrasound is looking at videos, and for us to look at these videos in real time, we need to move the probe over the patient's body. Think of moving a probe on the surface of my palm. It's going to take me less time to move this probe or the probe on the surface of my palm, and it's going to take me longer time to move that probe on the surface of my abdomen because my abdomen is larger. So the size of the patient actually play a role. Also, the technique, it is easier to maneuver when you're scanning a slimmer patient, and the maneuver technique is more difficult or complex when you're scanning a patient that is on the bigger side, especially if the region is more complex. Think of scanning a patient with smaller breast, for instance. You're going to live faster than when you're scanning a patient with a bigger breast. So the size of the patient or the size of the region in particular actually plays a role in the duration of your scan. Another factor is the sonographer's experience or expertise. This does not mean that if your sonographer is taking so long, he or she does not know what they are doing. It is simply individual preferences. Some persons are more thorough, some persons like to take their time. And experience comes to play in the sense that for a junior sonographer, he or she may like to look at a particular video or a particular region multiple times for them to be able to make proper diagnosis. But for someone who is far more experienced or who is far more confident, they only need to look at it once and they are good to go, because they've seen it over and over again, and it's very easy to recognize it by just looking at it once. Like I said, this does not mean that when your sonographer is taking so much time, he or she does not know what they are doing. Some persons like to be thorough. Think of it this way: all athletes does not run at the same speed or cannot run at the same speed. Some are faster, some are slower. It all depends on their preference. Some people are more thorough, some people are less thorough. Some people like to take their time, others do not believe in the idea of taking so much time. But this all boils down to individual preferences, the expertise, and their experience. Another factor is the presence or the absence of a pathology. A person who has a normal study, for instance, will live faster than a person who has a pathology noted on their scan or during the course of the scan. A normal study, the measurement is less, there is nothing keeping you there, the scan is just simple and straight to the point. But the moment your sonographer spots a pathology, he or she is going to try to ascertain what kind of pathology is that. When I say pathology, something other than the ordinary. Let me use that word. Something other than the ordinary. When they see something other than the ordinary on your scan, they would have to take more measurements. They would have to do more comparisons. They would have to look at what exactly is going on, especially if it's a pathology that is rare. They will try to figure out what exactly is happening, and that can add up to your scanning duration as well. This does not also mean that the moment your sonographer is taking so much time, there is automatically something wrong with you. No, but that factor can also play a role in increasing your scanning duration. Also note that when your sonographer is quiet, when they are concentrating on the screen, when they are taking so much time, it doesn't always mean that something is wrong. They are simply being thorough, because the report we give comes from our head. It is like watching a movie and trying to explain it later on. And while you are explaining, you are not actually watching. It is like trying to recall. You are simply recalling what you have watched and then putting it in form of a report. So while they are scanning, they are trying to take note of the appearance, the size. Most of the time, they are even cramming numbers while they are sitting with you. So when you are on the bed, relax. If you have any question, you are free to ask and you will get answers. But there is no need to panic, or there is no need to hurry your sonographer. Take your time, be patient, and allow them do their job. Don't hurry them, so that you can get the best possible diagnosis or the best possible results. The length of your scan is not a sign of bad news. It is simply an indication that your sonographer is being thorough. I hope I've been able to answer your question, and I hope this video helps next time when you think about how long an ultrasound scan is supposed to take, and then you know that the duration is not entirely dependent on any specific time, but on these factors I have mentioned. If you have any more questions, you are free to drop it in the comment section and I might just make a video on it. If you also have your experience you would like to share, feel free to drop it in the comment section. Don't forget to like, share, and subscribe. Also turn on post notifications so that you don't miss out on any videos I will be dropping in the future. And I'll see you in my next video. Bye bye.